Hello, everyone, and welcome to the Got Mental Health Podcast. I am your co-host, Rachel Cove. I'm the owner of Transformational Solutions, a life coaching business that specializes in addiction, trauma, and self-destructive behaviors. I'm an author, podcast host, group facilitator, speaker, and co-creator of the online 8-week self-development course, The Visions Program.
I'm your co-host, Arthur Mogilevsky, a business entrepreneur, dad, animal activist, and owner of AM Healthcare, California's leading dual diagnosis and mental health treatment centers, focusing on comprehensive and immersive treatment experiences with a network of facilities and dedicated professionals committed to providing each and every client the intimacy of care they so richly deserve.
This is the Got Mental Health Podcast, a fun, open, and safe space where we talk to experts, thought leaders, and professionals in the mental health field.
Our goal is to educate, inspire, and empower people to take care of their mental, physical, emotional, and spiritual well-being.
Join us weekly to hear Arthur talk like this as we talk all things mental health.
Follow us wherever you go to get your podcasts.
And don't forget to rate and review as it really supports our show.
Thanks, guys.
And keep listening to Arthur. Hello, everyone, and welcome back to the Got Mental Health Podcast. I am your host, Rachel Cove, along with my co-host, Arthur Mogilevsky. And today we have the fabulous Loree Cohen in the house. Woo! I'm so excited. Loree Cohen is an LCSW therapist. She's also the clinical director of Inneractions Outpatient Facility. Welcome, Loree Cohen.
Thank you, Rachel Cove.
I'm so grateful that you're here. And I can't wait to explore everything that we're going to talk about today. Arthur, are you happy she's here?
I'm just so thrilled to have the one and only. We obviously get to spend a lot of time together, but being in a very mic'd up situation is a first for us. So I'm very excited. I know we have a lot of fun topics to talk about.
Why do you guys get to spend a lot of time together?
It's a great question. We work together.
Where do you work?
At Inneractions intensive outpatient programs here in Encino. And, we've had, how long has it been? 4 years?
I think it's been about 4 years now.
4 years. 4 great years. Ups, downs, just like in most relationships. But it's definitely been one of the most exciting experiences of my life.
Why?
It's a family-like environment. I think that's why we're also inviting Loree to be on this podcast, is to gain her knowledge and experience on, the environment that she's created. I wake up every morning enjoying to drive to come to work for 45 minutes because I feel like we're part of a family here. So
we are. In fact, it's interesting because for a period of time, right, we just came off COVID and quarantine, which was really. That was a tough time because everybody was separated, so coming back in, it really brought home how much that team and that family means.
Yeah, it was really interesting because you can feel like everybody's excitement and anticipation to come back into the office, and how everybody was already getting, a little antsy. It was like, all right, let's get out of the bubble and the four walls that we're in at home. And it was just an exciting time to come back in person.
Yeah, I remember the week before we left for the pandemic. And I'm Inneractions is like my home. And to leave here felt like I was losing my family. And I feel like that's a testament to what you've created here. And I want listeners to hear more about your story and how you actually started Inneractions. So when did that start and how did you do that?
God, interesting. Well, I was working in a residential treatment center, and it was all women. And one of the things that we did really well was we worked closely with the clients. We did a lot of therapy. We really helped them with, kind of working through their trauma, developing a better understanding of why they chose to do certain things, and helping them choose, again, better, more productive behaviors. So that, they would do a lot of really good work. We would refer them out, and they would go to, intensive outpatient programs wherever they were coming from, if they were going back home, and got a lot of feedback. Hey, this isn't working for me. All I'm getting are a bunch of handouts. It's all education. I'm not getting that therapy anymore. So there were two other people that I worked with. We decided to start our own IOP that really focused on the mental health piece, because that seems to be what a lot of programs were missing. And this was back in, when did we start? 2013. Mm-hmm. I do think, there may be more that focus on it now, but there weren't then. So we created a mental health program for substance abuse clients.
Can you define that for me?
Which one?
Well, what is the difference between a substance abuse program versus a mental health program?
You want me to be honest? From my perspective, nothing.
Thank you so much for saying that. I love that you say that. And again, for everyone who's listening, we're going to be talking about things on here that you may not agree with. And what I want to ask you to do is to open your mind and be willing to listen to something that could be a different opinion than yours. It could be something that you've never even thought of, but I think it's important to learn a new perspective. And Loree's been doing this for 30 years?
30 plus. A lot more than that, yeah. And, again, for me, it's always been clear that, there are underlying issues, and that, the substance is what we've used to cope, to avoid, to numb, however you want to look at it. So if we don't deal with all the underlying issues, we're not really getting to, the substance. And so you're going to continue at some point, whether it's, drugs or alcohol or other behaviors, right? Something to kind of self-medicate.
So I have a question actually about that, right? Because substance is the more prevalent kind of use case to manage and cope with a lot of these underlying issues. But I mean, would you say that it's very similar to, let's say, gambling or love and sex relationships and issues in that realm, or dare I say potentially even eating disorders? Can you talk a little bit more about that, and can you relate that as well?
Yeah, absolutely. I think not only those that you just mentioned, but our cell phones, again, the internet, all the process addictions. That's clearly a new one that has developed over the last, whatever it's been, 10 years or so, and which is getting out of hand.
Right.
So that's one. I think I can actually even share a little bit of my own personal history, right? So I grew up in the 70s.
Hot take.
Very, very different time, right? Everything, open game, right? We could do anything. Drugs, alcohol, right? Sex, love, rock and roll, that whole bit. And, so that was accepted, right? So as I'm growing up, having a great time, my mom, I was about 16, realized that she had a problem with alcohol. I knew nothing about alcoholism at that time. So she got sober. I started learning more about the disease, the process, and what that might mean, for me, looking around my peer group, what they're doing, how they're functioning, the choices they're making, and how, the drugs and the alcohol really affected, our behavior, And so I started looking at things through a different lens. Made the decision by the time I was 17 that I didn't want to drink, smoke weed, do anything else anymore.
You were seeing around your surroundings how it can relate to what your friends were doing,
right?
To your mom.
So I made a decision to stop drinking or using any kind of drugs. What happened for me, and this is where it gets back to what you were bringing up, is without any knowledge or understanding of what the drugs or alcohol were doing for me, unbeknownst to me, I moved right into an eating disorder. So again, and then that took years before I became more aware of the process I was involved in, and I got help. And through that, again, started to make other connections. So yes, you can. They're all connected, and I think it's kind of like that whack-a-mole. Without doing the underlying work, you you got this part and it moves over here, and now you keep chasing it. So I think all of those things we want to be aware of, and that's why it's really important to figure out what's really going on.
So your role at Inneractions is the clinical director.
That would be right.
Can you share what your role, what does your role entail? What are your responsibilities? I want to hear. First, we'll start with the responsibilities.
Yeah, a day in the life.
Can you answer that question for me, please?
Honestly, I don't know how you do it.
You know, actually, the role has changed. You know, as we change, as we grow, it.
Yeah, talk about that. You know, honestly, and I hate to interject. Obviously, you're on a roll, but first of all, I love the cycling. You're going backwards.
This is
now.
actually.
This is
I know. I have to
no,
switch
it's great.
up.
Keep going. No, but I think it's not only about what your role looks like right now, but you're a veteran. You've been in this space for such a long time, and the space of mental health constantly changes. And that's because they find new ways of treatment. That's because insurance companies start regulating differently,
right,
or requiring certain things, because licensing changes, because just the general community and the world we live in changes, right? The things we worry about today, we didn't worry about 20 years ago, right? And so not only what does that look like for you now in your day-to-day, but how has that changed for you in the past 20 years?
Great question.
Oh gosh, I think, you know, people are people. We're all human. So in terms of emotion, I don't know that that's changed a whole lot, right? We all tend to want to feel good and we want to feel okay. So we look for whatever means there are. That part, I think, pretty much remains the same. I think we have a lot more options and unhealthy options today than we did before. Just like I said, technology, right? So we have a lot of resources that can lead us to, you know, unhealthy lifestyles. What's changed, I think a lot of treatment has changed. I think that we have really developed a better understanding and we have more evidence-based therapies to help with a lot of different you know, issues and diagnoses unrelated even to medication. So we take that off. What has changed for me, and you know this because my pet peeve is that the analogy I have is, you know, kids in school oftentimes are learning, right? The learning is geared toward the standardized testing, right? So are you learning to learn things because you want to understand, you want to know, you want to grow, or are you learning to take a test, right? Same kind of thing. What's happening now in our industry is insurance companies are dictating treatment. The clinicians aren't doing that as much. So we have what I've seen change over and over again, or I shouldn't say over again, but continually change, is how we are documenting and how we are helping support the clients. That has changed. It's more geared toward what the insurance company, you know, would like to see and how they want it documented. The work we're doing remains the same.
Crazy. They have no interaction with the client. They've never met them.
No.
They're a piece of name on a piece of paper or computer.
Oh, I was going to say something
I know.
else.
I want to.
I want to as well.
No, I want to. Yeah.
It's infuriating. And a part of me feels, okay, well, at least the insurance company provides some time for people, but it's not enough time. And I feel like they dictate the treatment that people get, and they dictate when someone gets to stay, when someone gets to go. And what is that like for you?
Well, that's what I'm saying. And I think those that I work with know I'm really passionate about that. And it's frustrating. I get angry, you know, and then I also have to, which is what I talk to clients about doing. Okay, here's my reality. Can't change it. I can get angry about it. I can express it. I do all of that, but this is what I have to deal with. So now how can I best help them? That's what I talk to all of my clinicians about. Yes, we don't like this, but what do we need to do so that we can help the client? So if they need us to document in this way, let's document in the way in which they'll understand it. You know, if they want us to talk to the client about certain other methods of treatment, let's talk about them, you know. So we just need to know that if we keep fighting the system, it's not helping the client.
As someone who's been in the industry for a long time, and maybe you already answered this, was it always this way with insurance companies?
Not at all.
And so in the past, was it usually private pay if you wanted to obtain treatment for yourself?
No, not necessarily. So there's private pay, and the insurance companies did pay. They just weren't as intrusive.
What would be the gain for them to be so intrusive?
Well, then
like, I don't understand.
Well, it's a combination of a lot of things, right? So first of all, insurance company is a business, right? It's in the business of collecting money on your premium and retaining that money as much as possible, right? There's a common misconception, right? Because people think, insurance companies, their business is to collect premiums and pay out, fees whenever services are provided. They're not. Their job is to retain as much cash in-house to earn interest on. And that's why they have these take-backs, even though they know they're going to pay you back, because that's a cash flow for them that they earn a certain percentage on, and keeping it with banks and investments and kind of tied to the stock market. That's where they really make their money. And so for them, it's always about retaining as much as possible. And so there's that fold, right? And then, and you have the other perspective you have to look at it as well. We're in an industry that has blown up in the past 10, 15 years. It's never been so populated with programs and clinicians and, you name it, right? It's a huge industry.
Why do you think that is?
Well, because number one of insurance reimbursements. I'm obviously going to disclose a little bit, but when I first got into the industry and I was learning and understanding, we got our first client, had no clue. It was a certain policy. We received reimbursement, and it was such an absorbent amount of money. I was shocked. Nor was I expecting this. But, so when you have doors that are leave open to these types of industries, you're going to have a lot of people flocking to it, right? And so it just blew up more and more and more and more. And now you add on COVID, that's fuel to the fire, because now everybody feels comfortable coming out with mental health and their substance use. Everybody has it. Everybody wants to seek help for it. And so now everybody's reaching out for it. Insurance companies granted virtual treatment, which wasn't available before. And so it was such a huge money grab in the past several years that now they've calculated it all. And eventually insurance companies saying, well, it's too much. We got to step in now.
And here's another thing. This is where I'm going to plug, the insurance company and some of their rationale too. The other part that we don't have to get into is that, over the last, 15, 20 years, there's been a lot of fraudulent behavior too. So, the insurance companies, they're, wait a minute, right? They're taking advantage of us right now. And so they've kind of geared up and said, we need to be a little bit more protective. We need to have eyes on.
For the people that don't understand the fraudulent behavior that has transpired, could you share what that looks like? What is some of the fraudulent behavior that has gone down that has kind of given treatment a bad name in the last 4 years? Body brokering.
That's a big one.
Yeah, that's a huge one.
Yeah, and I'm forgetting the term, but again, treatment centers buying insurance policies for clients just to get them in, and then again cutting off the policy at the point in time that a client then leaves treatment. That's not a policy that the client had.
There's
so many different.
There are people body brokering is obviously the largest piece, right? But there's so much underneath body brokering, like people going into meetings, which should be a safe space.
12-step meetings.
12-step meetings and offering substances to newcomers, and, to get them into treatment. And it's so disgusting.
And newcomers are people who are newly sober.
Yeah.
And going into treatment, literally going into detoxes and residential treatment centers and taking people out, getting them loaded.
I have a crazy story. I was in this. I was in this facility. I was doing some consulting stuff for them and helping them kind of structure their facility. And I was in the office, and in walks this kid. He's like whatever, in his mid-20s or whatnot. You can tell he's not from there. And he just sits down. He's like, I think I'm ready to leave. And, obviously the team is trying to help redirect and all that. He's like, no, honestly, I don't think I need to be here. And, sometimes clients say, I don't think they need to be here. Maybe they're not ready, whatever the reasoning is. He starts going off and saying that, yeah, I was was told to, if I come out here for treatment, they'll pay me money and they'll pay for my flight. But I don't have an addiction problem. Like, I'm not an addict. I was just I saw the ad and I responded, and they paid me to come out, and they would pay me to be here for 30 days and to utilize my insurance policy. And I'm just sitting there. I'm like, wait, so hold on. You got on a plane. You're not an addict. You don't have a problem with any substances. You're just here for the vacation, and they're paying you for it and utilizing your insurance. Obviously, I started questioning the facility that was helping structure.
Yeah.
But at the same time, I was like the extent that people go through to do these types of things is unbelievable.
Yeah, it's shocking. I'm not actually even shocked anymore because it's been happening for so long.
It's so disturbing. I mean, do you feel like these people are sociopaths?
You didn't.
I'm sorry. I had to bring that up because I really questioned how, I mean, obviously money motivates people to do things they would never normally do. And yet it's so disturbing.
I mean, in a sense, I think it depends on what we're talking about. Do I think that they're all sociopaths? No. Do I think that there's a criminal element? Absolutely. My old partner used to say a lot of these people are drug addicts, and instead of dealing drugs, now they're dealing people, that they've kind of moved into that. No, there's no question that there's a criminal part. There's also that unbelievable, fascinating ability for people to just kind of restructure a story, right? And deny what the reality is, and have this ability to kind of justify bad behavior, right?
It's justifying.
Yeah.
And it's really sad because at the end of the day, there are people that are not getting the help that they need because of this criminal behavior that's going on. And I mean, we all have heard of some of the people that have been in the news that have done horrific acts towards innocent people who are coming into a treatment center that should be safe. And that's actually a question I want to ask you is how do you as the clinical director provide a safe setting for your clients?
Oh, that's a really good question. I have to actually think on it. I don't know exactly. I mean, I think part of it's just the team, right, that we build. It's the personalities. I think the clients, when they come in, it's about the relationship. So let me just start there, right? So I believe that the best therapists are the ones that actually can create that relationship so that they know, the client knows that it's safe. They know they're being heard. They know that the person that they're confiding in isn't necessarily directing them, isn't telling them what to do, but helping them learn more about themselves without judgment. So, I think that you have to be adept at choosing, right, the people that are going to be working in your environment.
I know what you do. I know what you do.
What do I do? I don't know.
Well, I've been working in this field for 13 years. I've worked at countless outpatient facilities. I own a life coaching company, and what you do is far different than any other facility that I've been at. And I think one of the reasons why it's so unique is you love people. And as soon as I walked into Inneractions, you greeted me with this effervescent personality. And the first feeling I had was, oh my God, I just want to be here. Because I just want to be here.
Yeah.
And you make people feel safe, and you don't make people feel judged. And I think people are coming into these facilities, as someone who's been in 15 years of recovery myself, when you walk into a facility or you're coming off drugs and alcohol, you are at your lowest point. You are so riddled with shame, and at the core of shame is I'm bad. And if you're being met with judgment, all you're going to do is run out the door. And what you've created Inneractions is this place of just you've created a family-oriented experience.
Oh,
It's
thank you.
It's so fun. 100%. We're still trying to figure out a way for you to stop coming in so often.
Thank you, Mogul.
Yeah, no problem. No, the funny thing is, it's like, so I'll get these calls and they'll be like, well, tell me a little bit about like, what kind of population do you serve? And I'm like thinking about it. I don't really know how to define that.
Yeah.
It's really interesting. The type of eclectic group of individuals, not only from a facilitator standpoint, but like clients. Like you can have someone who's 18 years old just trying to figure this out. That's from like the Midwest of the country. And you could have somebody that is, a world famous chef that's just trying to figure out how to navigate depression. Right. Or, you know what I mean? And it's such an amazing experience overall, because honestly, Loree and the team have created this environment where anybody can come in and feel safe. You know what I mean? And truly, so.
It's interesting. I hadn't really thought about, what you just said. A lot of programs, right, for whatever reason, they seem to be heavy on, let's say, 18 to 25-year-olds or this. And we really do. We've got this just beautiful mix of people.
Absolutely.
And it just works.
And so many clients, and again, I'm not kissing your ass. I love your ass, but I'm not kissing it. I'm just being
Ladies
truthful.
and gentlemen, the word ass has just been used.
It's going to be okay. If you don't feel a sense of safety in this moment, you can always call Loree for therapy.
And I'd be happy to provide it. That was good. Nice plug.
Thank you so much.
Have my
One thing for sure Inneractions does is there's so much depth in the work that's being done here in the groups and in the one-on-one individual therapy sessions. I can't tell you how many times clients have come up to me afterwards and they say, "Oh my God, I love being here because I'm not just getting worksheets."
Yeah.
So many outpatient facilities, they hire facilitators and they just do worksheets. And there's I'm not saying there isn't a benefit to that. But at the same time, you can't get into the core of the problem with worksheets done all throughout the day. Would you say so?
I
would
say so.
I
would say
Do you
so.
feel the same way?
Do you feel that way, ma'am?
Yes, sir.
Was that
I don't know.
Southern?
I was trying.
Was it British?
I was trying for Southern American, and then somehow some Texas kid in there.
Would you feel that way, ma'am?
Yeah.
I'm going to respond with a California accent.
Please
now.
do.
Thank you so much.
Thank
Los
you.
Angelian.
Yes.
Los Angeles. Angelinian.
Angelinian.
Angelinian. Is that the?
I don't know.
I just made it up.
It works.
Whatever.
That's it now. Oh, shoot. What was the question?
Well, no, we were just talking about worksheets and like
Right.
the difference between other outpatients and Inneractions. And I'm not here to knock other outpatients. There's phenomenal outpatients that are not Inneractions. But I will say the thing that I most often hear is the facilitators spend so much time helping the individual client without worksheets.
Right. No, and that was one of the things that I was adamant about. I don't want it to just be all about the worksheets or being didactic, so everything's up here. It's both, right? And you want to have a nice balance, and that's why we also do other types of groups. So, I mean, we do the improv group, which, some people shy away from because it can be a little intimidating, but it's incredible how, while having fun and laughing, how you can get to some really core issues, and you challenge yourself. You work through some of the anxiety.
You're talking about the improv groups with my BF, Bethany Dwyer.
That is the one I'm talking about.
I've been a part of those groups. And I'm not saying this because I love her and she's one of my best friends. I'm saying this because people don't realize how healing laughter is. And Bethany, this is Bethany's quote, like there's nothing that will bring you into the present moment like laughter. And I think that's why Inneractions is also so different is you have so many different types of groups.
Right. And that's it, because not one thing works for everybody. So that's why, again, what we want a really well-rounded program so that everybody gets to experience something that's going to help them.
And was that always your vision when you created Inneractions from the beginning?
Yes. And it's funny because when we first started, it was just the three of us, and we had one other facilitator we brought on, and we were doing everything. It was like leaving the group, putting on another hat, going back in, and doing everything. And after a month, I said to my partners, this isn't fair to the clients. We've got good stuff. I mean, we're good, but we need to bring in more. This isn't enough. And that's when we started really, increasing the, not just the facilitators, but the types of groups that we were doing.
What do you think the value is of groups versus individual sessions?
I think both are necessary. I mean, I think they both have value, but, the group experience is different. One, I want to see it's less directable. You don't know. You never know what's going to happen. There's so many variables. And a group facilitator can manage that. You know that. You never know what's going to pop up or who's going to react and respond in a way. And you have to be on your toes. But it also shows the clients that this is the world. This is what we live in, right? You don't know what's coming at you. And so to be able to navigate the feelings that come up, the responses that come in, and help the clients, that's like real life experience. So for me, group, right, is experiential. All the stuff that may happen out there can happen in group. So I love that. Individual, then again, it's more the attention and the work is directed more toward specifically you and what your needs are.
I always view, obviously individual therapists, but group facilitators as like artists, directors.
Yeah.
Because honestly, I've just witnessing a few myself. You're literally directing a group of people, like you said, that are going to throw anything at you. So it's literally improv every single time, right? And you have to, as the facilitator, balance the group. You can't get too high. You can't go too low. You can't go too far, too right. You got to keep it as centered as possible, where everybody can gain something out of it. Because we've seen groups where an individual just took over the entire group, and for the entire hour it was just about them, right? And so that's not fair to the other clients, right? So as the facilitator, not only are you bringing in the topic, but you're also directing where that topic goes. It's amazing.
And that's not an easy thing to do.
It's not an easy thing to do. And as a facilitator, it's a balance too, because those people that are essentially taking over the group, sometimes they've never had attention in their life by any caregiver. They've never had attention like that. So as a facilitator, I don't want to take that away from them. And I have to make them feel important, and I have to show them that I want to hear you, I want to see you, and we need to let other people be heard and seen at the same time.
It's a delicate balance, right?
It's so delicate.
Yeah.
Where did you learn how to facilitate groups? Where did you go to college? Tell me everything.
Did you go to school, ma'am?
In 1916. I'm kidding. Julie, I love you.
Damn.
I'm sorry.
And that's the end of that interview.
Can you repeat that question?
Sorry, I was totally kidding. Where did you go to school?
I went to school. I just kind of hit the LA circuit. I did CSUN, believe it or not, for undergrad. And then I went to USC, School of Social Work. And then I went to UCLA for postgrad.
Had you always wanted to be a clinical director?
Oh, I don't think I even thought about that. I wanted to be a therapist.
And before then, weren't you working at a psych ward?
Yes, I was.
I really want to hear about this, because you are so brave for entering into that space. I have no experience working in a psych ward, and I know that you're someone who really got a lot out of that based off personal conversations that we had.
And follow-up question to that after is, why social work?
Why social work as opposed
to MFT, psychology, and that speaks a lot to psych wards and being able to so many different populations. I'd love to hear about that.
Well, part of that was, again, remember back when I was, and this was mid 70s, right? I was going into college. So MFTs weren't even MFTs then. So it was, people were getting their MFTs. You could mail in for those. So there wasn't a lot of clout, being an MFT. And still, social work, it's broader, right? And if you were a social worker, yes, you had choices. You could be a clinician, just private practice, or you could run a hospital. So I knew that then there was a lot more choice. And I do, the way I think, I look at things on a more holistic, a broader perspective, and then bring it in. So that was just a good fit for me.
Yeah.
And so an MFT is a marriage family therapist.
Yeah.
When you say I look at things from a holistic perspective, what is holistic? What is the opposite of that? If people are
okay, so you're looking at micro versus macro, right? So an MFT schooling is really focused on, right, the client. So the client can be one particular, or it can be the family system, or it can be the marital right, system. So you're just focused on that. Social work, right, looks at everything. Society, right, the societal pressures. It's how your business plays into things, the family. So it does the same thing that the MFTs do, only it looks at more.
It looks into all the different
The
dynamics.
religions, the culture, everything.
Yeah, because I feel like everything feeds into who you are. It's not just one thing, right? I mean, it's like even your dietary plan or restriction or whatever, right? It's how you exercise, it's where you work, it's where you live, it's where you were born, it's who your family. There's so many pieces to it, right?
Yes. Now I do want to say my mom was an MFT, and she was great, and she actually became an MFT after I went to school for mine.
That's amazing.
And, again, she was an MFT, so which helped me start to look at, okay, so that they can get, a broader picture. And I've worked with a lot of MFTs, even though the schooling may have been focused on that. Think more like a social worker. My ex-partner was one of those. She didn't look at just that system. So I think today the MFT is different than the MFT was back then. So I give them a lot. I don't even want to say credit. I look at them differently than I did then.
I also think we're treating people with that come from so many different backgrounds. Their traumas are all different. Their childhoods are different. What they've gone through is different. We can't treat everybody the same way.
Right.
So you have to be able to look at everything, in my opinion, from a holistic point of view and treat the individual and not treat. I think you have to learn a bunch of different modalities to see what fits with this one person. I think that's where a lot of people go wrong, is some people benefit more from CBT. Some people benefit more from DBT. Some people don't benefit from DBT or CBT and they need EMDR. And I think everyone is different.
Right. I would agree. And even as a program, right, we look at all of our clients. We may have an overall structure, but what the client needs is going to be different. And the way we approach each one is different.
And I love that. Like, the way that you approach each one is different. I think that's what makes Inneractions such a successful program. I'm curious, what are some of the challenges that you have dealt with as a clinical director?
Oh, you mean, oh God, that could be all kinds of things.
Besides me.
Besides Arthur Mogul.
I was just trying to figure out how to go there.
I don't have an ego. I'll admit it.
No,
really?
Well, not on camera at least.
Okay.
No, for the most part, you're actually not a challenge.
You hear that, honey?
Anna, what do you think?
Yeah. Well, we're talking about here, your work family.
Yeah.
The challenge in one sense, like we already talked about, is the insurance company and really doing our best to get the clients what they need. And so it's always, when you've got a business, honestly, it's weighing. It's trying to balance the business and the clinical. And I think in a lot of businesses, right, clinical is, clinicians kind of grow up thinking like clinicians, right? And it's hard, it's all about the client. It's hard to actually bring that business side into it. I was really fortunate because I started off in my career really being brought into, I was really lucky. I had a lot of mentors. So I learned about, marketing, business development, about the business side, and having to really find that balance. So, but that's still, it's an ongoing problem, right? Where, Arthur knows, I want us to scholarship everybody, right? As long as there's, and you can't do that. So that's probably one of the hardest things for me, because I do, as a social worker, right? I want to just be able to give everybody what they need in spite of whether they have insurance or don't have insurance. And we do. I mean, he's been extremely gracious and has we've been able to create a system here where we have some ability to scholarship.
As companies grow, how do you still provide the individual care where the client does not become a number?
I think, well, part of it is keeping the ratios, right? So you have to make sure that if you grow to a point where, let's just say your therapists have a caseload of 26 people. I don't know why I came up with 26, but, you go, they're going to be, right, the clinician, it's too much for one clinician. They're going to be, deprived. They're going to, I can't speak, depleted. Then you have to take a look at that. So the client's not going to get what they need, right? So that's one. Let me think. You tell me, Arthur.
Well, I mean, I think it's something in discussion with our HR director, and really trying to create a fun environment outside of the workplace. Like, we're thinking of we're gonna bring in like a chef, and we're gonna do a cooking class as a team. We're gonna go to one of the, like, a break room where we just go in and start breaking things.
And what else are we gonna do?
Are we? We as in
Yes.
I'm included?
Sure, yeah.
Are you talking about the rage room?
Rage room?
Oh, yes.
Yes.
Uh-huh.
I'm included.
Oh,
Yes.
you're included.
So
now you are.
We'll add that to the list. We love you, Rachel.
No, laser tag is still
Laser
at the
tag,
top of my
laser tags on the
list.
table, bowling. So, like, because honestly, and it's just to kind of speak to what you were saying a little bit earlier, when I got into this space, I've been in healthcare for a very long time. Prior to this, in geriatric care, my passion is to help people. That's my life is driven towards that, just naturally, not because I said I'm going to do that. And it's hard because when you grow and your organization grows, it's balancing, right? Money, income, partnerships, questions, your own family, lifestyle at home, taking care of the patients, taking care of the staff that work with you. And it's a very difficult road. And obviously, as you grow, you start losing sight of the things that you initially probably came in with, right? Because there's so much being dumped on, right? And, the beauty of your and I relationship is you understand both sides of it. I try to understand both sides of it, and usually we can meet in the middle. I recently even came up and saying, like, let's start scholarshiping people again, and really going back to those roots, right? So I think it's as you grow and you adapt, I guess, again, from my side is you start figuring out, okay, we started missing this. What can we do to incorporate more? And I think as you grow, the family becomes bigger. It doesn't feel as homey as much. So how can we create a homey environment with a larger family, right? And so I think it's doing fun things like going to a rage room, or so we're starting to look at implementing those things, and hopefully that helps a lot.
Yeah. And again, and we increase the staff too. So again, the staff has, a smaller pod, right, that they're responsible for as well. There's lots of different ways, I think. And we're also, one of the things that we've talked about doing too is keeping the lines of communication open and having, again, more staff meetings where we say, what isn't feeling right anymore? Is there something? And let's brainstorm. What can we do? And so including the staff in on that process.
I love that.
I want to be a place where other therapists and other professionals in this industry can feel like they are hearing things that they relate to. And working in this industry is really hard, and it's really overwhelming, and the stress is sometimes debilitating in moments. And the stories that we hear, the trauma that people have gone through, it weighs on you. Yeah. And I'm curious how you've dealt with that throughout all these years.
Yeah, it's funny because we work with we're interns now, or associates, for anyone that doesn't know the newest term. And that's always the question. I have a daughter who's now a social worker, and I remember when she had her first internship, she goes, "Mom, how do you go home and not take all this with you?" And I don't have a really good answer for that. I think one of those things, it's time and experience. But, one of the things that I've always done that's helped me personally, and I think everybody's going to have their own, is I've always been into exercise. So for me, that transition, and what I used to do is leave work and go to the gym. So that would be my, kind of transition from work into my life, where I just kind of leave everything behind. It doesn't always work, but it does. And it's learning how to compartmentalize.
You really taught me that. You really taught me how to compartmentalize this, because I go into every session, every group with my bleeding heart, and I feel like I'm in the pain with them. And I've had to learn how to disassociate intentionally. Yeah. And because it's a lot, what you're hearing is really intense.
But what I think one of the things that also helps, because you do it and I do it, and I've had therapists say, you can't get teary when you're with a client. Well, I get what I really am.
I just got the chills because, sorry to interrupt you.
Go
I'm
ahead.
working on it, but you have been one of the most influential people in my life around groups, other than the other things that you influence in my life. You gave me permission to be human in groups. And I think that's what needs to change in this industry is facilitators and therapists need to stop pretending to be these robots that has their shit together all the time, because clients end up idolizing these human beings and thinking that they don't have any problems of their own. Mm-hmm. And then they strive to be this perfect person. Mm-hmm. And I've cried in groups and you gave me that permission, and it only made the clients relate to me more.
Right. And then it gets back to that whole feeling of safety, right? They feel safe. Whereas, again, old theoretical perspectives was, again, the blank slate, right? And that's what helped clients feel safe. But if you talk to clients, and I've been a client, right? I feel safer with somebody that I really feel is connected to me, right? And it gets into that whole issue of connectivity.
And for someone who has led a lot of groups, what is your opinion on self-disclosure?
You know my
I
opinion
know, but
on
I want people to hear this because it really helped me.
Again, it's differentiating between, am I sharing a part of myself or an experience I had because I need to say it, I need to vent, I want to be seen and heard, or it's something that I believe is actually going to help that client. It's either going to help them with the knowledge or it's going to help them feel safer with me. Again, building the relationship. So again, what's my purpose? Is it for me or is it for them? If it's for them, you go for it, right? And part of that, I think, for me was probably developed because I've worked in addiction for so long. I actually started there. And, there's so much self-disclosure when you're talking to addicts, right? Are you in recovery? And, and that kind of stuff, that I think it got my brain thinking differently, because we were not taught back then that self-disclosure was okay.
No, you weren't. And that's why when you told me to do that, it was shocking and yet also really exciting when you told me I remember we had a client die a long time ago, and you told me right before I had to run a group.
Oh, yeah.
And I loved this client so much. And I remember saying to you, I don't know if I'm going to be able to hold my tears back. And you said, so don't. Show them the impact of what loss does to you.
Yeah.
And that is what loss does. And I had to show them, hey, I'm deeply impacted and negatively affected by this loss. And this is how I'm going to work through it the rest of the day. And I'm going to show you my tears. And we all know, my whole thing is helping people cry.
Right.
Every day.
Every day.
That's why I bring Palo Santo with me, and no one likes it.
Rachel has the there's something about the eyes, and it gets everybody crying.
That's sweet.
No, and and here's the thing, and I do want to say this to other people, just because that's my belief and it works for me and it's good for you, not all clinicians believe that's to be true. They just they don't do it, they don't agree with it. And that's okay too. There's a lot of different methods, a lot of different belief systems, and we've got to be okay with everybody. But this place is kind of run under that premise.
So when people leave Inneractions, when a client leaves Inneractions, what do you hope they say to you? What do you hope they feel?
I mean, yeah. That's a great question. You could have given me that heads up.
I'm giving it to you now.
Let's see. What I want them to be able to say that they felt safe, that they were able to do work that they haven't done before, that this is a place that they would send their best friends to. Mm-hmm. That would probably be, the best thing, because they obviously got what they wanted.
Yeah, no, that's great. I have a final follow-up question for you. So imagine you have the knowledge. Well, of course, you don't have to imagine. You have the knowledge that you have now, but imagine you were able to go back 15, 20 years from today, and you're able to give yourself that piece of knowledge. What would you tell yourself?
Wow. Well, you mean all of this, like the self-disclosure, or you mean just anything?
The person that you are today. Who you are, everything that, obviously every instant and every moment of your life makes you who you are.
I would probably tell myself not to be so hard on myself and to just relax and trust, have faith. That was always harder. That was a hard one for me.
That was a really good response. To relax, to trust,
To have faith.
to have faith.
And honestly, the biggest thing, but I think this I did, is I approach everything with humor. You know that. Probably it might be too much, but
It's not.
It's never.
and that's the other thing. It's just, I still feel like
Have
that.
fun.
Have fun.
Yeah.
And we definitely
Sometimes
have
a little
fun
too
here.
much.
Yeah, after hours.
Yeah.
Right?
Yeah,
Fun.
well, that's why it's hard to leave here, because I always have so much fun. And on that note, I just wanted to say thank you for everything that you do, for making, honestly, I'm not going to cry, but I probably will cry. Being excited to come to my job is a gift. And it's a gift that so many people don't have, where they feel like going to work is just this awful, horrible, tedious task that they regret having to do every day. And I love coming here. And even when I've had to decrease groups just because of my own personal career, I mean, it's devastating because of what I get here. And so I love you so much with what you've given to me and what you continue to give to everyone at Inneractions. And I really appreciate you being on this podcast today.
Thank you.
We absolutely
I love you, and you know how much I appreciate you being here, and thank you for that. And this was actually fun. This was fun. I was nervous, but it was fun.
I'm so glad. And to everyone out there who is listening, please go to Apple Podcasts, rate, review, and follow. And thank you so much for all of your support. This is Got Mental Health with Arthur Molosiewski.
Mogilevsky, Rachel.
Okay. And we look forward to hearing all your feedback, and we'll see you next week.
Pleasure. Thanks, guys.